All right, we're going to move on to section 2A. Section 2 of the plan is quite long, and so we've divided it up into two sections. This is the first portion, and we'll be doing the second portion a little bit later today. So I'm going to turn it over to Safi, and she will be sharing where to find the resources for this section on our website.
Thank you, Shar. So I just wanted to show, I'm going to grab the screen for just a moment, as a reminder that every slide that we show today is going to be available on the Tribal CCDF Plan Preprint resources site. If you scroll down today, we are starting off with section 2. Section 2 is broken up into two parts, and then after those two parts, we will be playing section 4. And so within that, you will see, again, the PowerPoint slides, any tips and considerations, and also any other resources that would be helpful alongside the resource directory. So I'll drop that link in the chat so that you'll have it, and it will have all of the sites available for you. I'll go ahead and pass it back to Shar.
Thank you so much, Safi. We're going to switch the screen back to the slide deck again, and we'll just take a moment to introduce ourselves as the presenters for today. My name is Shar Shank, and I'm the Deputy Project Director for the Tribal Child Care Capacity Building Center. So happy to be with you today, and I'm going to pass it off to Carrie.
Hi, good morning, everyone. My name is Carrie Stansberry, and I'm the Technical Assistant Specialist for Region 9, and I'll pass it to Kate.
Hi, everybody. My name is Kate Gordon, and I am the Subject Matter Expert in Quality Improvement, and I will pass it back to Shar.
Thanks, Kate. So as we move forward in the presentation today, please feel free to say hello to the group, into the chat box, letting us know which tribe or tribal lead agency you're representing. And remember, you can stop us at any time and ask questions by using the raise your hand icon or by submitting your question in the chat box. We want to make sure that you get all of your questions answered, and we'll monitor the chat box as we go along as well. Our objectives for today are to understand the importance and application of health and safety standards across all allocation sizes, provider types, and age groups, to demonstrate a deeper understanding of all the required and optional health and safety topic areas, and to develop an understanding of the health and safety training requirements. Section 2, Health and Safety, covers 5 different subsections, including standards and monitoring, training requirements for CCDF providers, monitoring and enforcement policies and practices, exemptions for relative providers, and comprehensive background checks. In this portion of the training, we'll be focusing on section 2.1, the overview of health and safety standards, and 2.2, health and safety standards and training requirements for CCDF providers that reinforce those standards. Please be aware that all health and safety requirements are applicable to all child care providers receiving CCDF funds, including those providers who are receiving only CCDF quality dollars through the tribal lead agency. Now we're going to do a little activity around self-care. In the in-person trainings, there were some goodie bags on the table, but we want to do something virtually for you. So self-care is so important in this work, and we can't give to others when we're not taking care of our own needs. It's important to reflect on what makes you feel happy or calm. This can include people, smells, places, experiences, etc. So grab a piece of paper if you have one handy, and a pen or marker to get started. So I'll give you a second to do that. And as you're doing that, we want you to take a few minutes to reflect, and we'd like you to write down 5 to 10 things that you do to make yourself feel happy or calm. We're going to give you some time. Hopefully you'll have a good list of things that makes you feel happy or calm. And I think our little guy with the opening prayer did that for me this morning. So thank you for that. So if you would like, you could pop some of your ideas into the chat box for those who are struggling to come up with a few ideas of what makes them happy or calm. We would love to see what your ideas are. We have listening to music. Love that one. Ah, lemon cake with my coffee now. I could use some lemon cake. Going for a walk. We have a couple of those, some exercise, deep breathing, spending time with your family, grandsons, talking to your children, going outside first thing in the morning to feel the morning air. That would get the day started out right. A neighborhood walk. Thank you. Another important piece of self-care is to know who is a part of your support system. So now if you could share a few people in the chat that you can lean on if you're having a difficult day. Oh, a massage twice a month. Awesome. So if you have any people that you can reach out to or lean on and want to share in the chat, that would be really helpful to others. Thanks, Sapi. We also want to mention you can definitely lean on your regional office staff and the TCBC staff as you go through writing your tribal plan preprint. We are definitely here to help you, and it's a safe place to ask questions. And we're here just to help you get your plan filled out, talk through some of your flexibilities if you need to, and support you. So as we move forward, you can keep this list handy to remind you that you could take a break from work and choose one of the items off the list, or pick up the phone and talk to one of the people you identified, or FaceTime them, or whatever else you need to kind of help you through the day. All right, so we're going to dive into section 2.1, health and safety standards and monitoring. And it's important for the CCDF Tribal Lead Agency to develop health and safety standards, and for the caregivers, teachers, and directors to know the standards that they're accountable to. The standards you implement are enforceable and legally binding and should be approved by your Tribal Lead Agency leadership. You can choose to adopt an existing set of standards, such as those found in the Caring for Our Children National Health and Safety Performance Standards, or the Health and Safety Minimum Standards, a guide for American Indian and Alaskan Native Child Care and Development Fund grantees, or your state or Head Start standards. You can choose to adapt an existing set of standards to meet your unique family, community, and nation's needs, or you can combine health and safety standards from these or other sources, or you could even develop your own standards. In the plan, you will choose from the Tribal Lead Agency develops its own standards. The Tribal Lead Agency requires providers to meet standards established by a state agency, such as a state licensing agency or State Department of Education, or by Head Start or Early Head Start. The next option is the tribal lead agency requires providers to meet standards from one or more sources. So for example, state licensing standards for off-reservation providers and tribally developed standards for providers on the reservation. Or your final choice is the tribal lead agency requires providers to meet standards from a source not listed in the table, such as Indian Health Services, the Child and Adult Care Food Program, Caring for Our Children Basics, and Caring for Our Children. Okay, so the chart in section 2.1.1.1 is arranged by provider categories and required standards. The tribal lead agency will need to indicate which of these standards apply to each of your provider categories. Depending on the type of care the tribal lead agency offers and the needs of the community, you may use the same type of standards for all provider categories, or you may elect different standards for different categories of care. So just be aware that your choices in this section will be limited to those that you chose early in your entry in section 1.7.1 in CARS. So based on those choices, CARS will only open those provider types in this particular question. So just a quick reminder, the final rule defines categories of care as center-based care, which includes your tribally operated center, family child care, and in-home care. And remember, you may have family, friend, and neighbor care, but you will need to select from those three basic provider categories within section 1.7. Along with the center-based care, family child care, and in-home care, you also have the choice in 1.7 for a tribally operated center. And grantees who use CCDF funds to operate a center-based childcare business using CCDF funds are considered to have a tribally operated center. This means the tribe oversees all operations of the program, paying facility costs, for example, rent and utilities, hiring and managing staff, purchasing equipment and supplies, and screening families for eligibility. Another choice is a relative provider. Those are providers who are certain relatives of the children they care for. So for example, grandparents, great-grandparents, aunts, uncles, siblings who are over the age of 18 and living in a separate household. Also, monitoring is a vital component of your overall health and safety system that is used to verify that the developed standards are met by your caregivers, teachers, and directors. And this question in the plan document is designed to identify who monitors the providers and facilities that are subsidized by your CCDF program. If monitoring inspection is conducted by someone other than the tribal lead agency, such as the state licensing agency or Indian Health Services, please indicate that in section 2.1.1.2. And that will tell OCC who conducts the visits and how the tribal lead agency obtains the results of the monitoring visits. Monitoring can be provided by a single entity or a combination of monitoring agencies, allowing for flexibility to ensure the best possible monitoring solution. So for instance, a tribal lead agency might partner with state monitoring agencies for those centers off the reservation while monitoring tribal childcare centers or family childcare providers within their own tribal monitoring system. In cases where a combination of monitors or inspections are used, please check all those that apply and provide a description. Tribal lead agencies must ensure that monitors are inspecting all of the required health and safety standards that you have approved and implemented. Monitors must also be trained to understand your tribal lead agency's adopted, combined, or developed standards. Tribal lead agencies that have a tribally operated center should pay special attention to coordinating with the monitoring entity to ensure accurate monitoring of the tribe's standards and training requirements. It may be helpful to review the updated Developing Childcare Health and Safety Monitoring Enforcement Systems Toolkit on our website once it's released. If you use only state licensed providers for all provider types, you will rely on state standards and state monitoring. In this case, you will automatically be forwarded to section 2.4 in the CARS system. Keep in mind that you still need a system in place to ensure that state licensed providers receive all of the required training. If you've adopted or adapted the state standards, it would be a good idea to partner with the state to fully understand each of the health and safety standards required. You might consider a written agreement with the state and/or providers. If you've chosen to rely on state health and safety standards exclusively, you may provide web links to the relevant state agencies' health and safety standards, training requirements, and monitoring practices. But please make certain that any links provided are functional and provide the viewer with the requested information. And just another note, if you use providers who are state licensed but also have relative providers, you would need to click the box, a combination of standards, or identify which standards your relative providers are following. Also, there is information to exempt relative providers. So now I will pass it off to Carrie.
You, Shar. So now let's move on to section 2.2, health and safety standards and training requirements. Sorry, for CCDF providers. Tribal lead agencies have the flexibility in defining standards and provider types that are reflective of the culture and language and that meet the needs of children and families served. For instance, the term grandparent care might be used by a tribal lead agency to refer to a provider category within both the family child care and the in-home child care categories. So what is a standard? A standard establishes your CCDF program's minimum expectations. A standard also sets the foundation for protecting the health and safety of children in childcare. It is a guideline that providers must follow to ensure the health and safety of children in care. A standard sets the expectation that inspectors and monitors can compare the actual practice in the home or center. Tribal lead agencies have the option to exempt relative care providers who are over the age of 18 years and who exclusively serve children they are related to from some or all of the health and safety requirements. The CCDF definition of relative care providers are those providers who are related to the approved child by marriage, blood relationship, or court decree, including only the following: grandparents, great-grandparents, siblings if living in a separate residence, aunts, and uncles. Tribal lead agencies must establish standards for CCDF childcare services that strengthen the relationship between caregivers and children, as well as provide for the safety and developmental needs of the children served. For caregivers, teachers, and directors to be ready to care for children, they are required to attend a pre-service training directly after hire or an orientation training within 3 months of hire that address and teach the health and safety standards that you have developed. These trainings must be appropriate to the provider's setting type and to the age of children served. Providers must also meet ongoing training requirements to maintain and update health and safety standards and demonstrate an understanding of child development topics. When caregivers, teachers, and directors are hired, think about this in phases. So phase 1, which is at the beginning of employment, can be either a pre-service training that occurs prior to starting work, or an orientation training, or a series of trainings that occur within the first 3 months of hire. Tribal lead agencies have the flexibility to choose which training topics need to be completed by caregivers, teachers, and directors before providing unsupervised care to eligible children. Phase 2 is ongoing training, which includes the topics that need to be completed on an annual basis to maintain your health and safety standards. The ongoing professional development curriculum should include a minimum annual requirement of training hours to be completed by your caregivers, teachers, and your directors. For each of the 11 required health and safety topics that we'll cover today, tribal lead agencies must provide their definition of standard. It is important to identify any variations in the standard based on the ages of the children served and the category of care, and to describe the training requirements for each standard. Standards may reflect the unique cultural practices and expectations that exist in your tribal communities. Standards developed, adopted, or adapted by the tribal lead agency should be approved by the tribal governing body and subsequently shared with providers, parents, and community members. So on the screen, you will see the health and safety required topics that you must adopt, adapt, or create a standard for in the fiscal year 2023-2025 Tribal CCDF Plan Preprint. Tribal lead agencies will provide a summary of the standards in their plan. So these topics are A, prevention, including immunizations and control of infectious diseases. B, prevention of sudden infant death syndrome and the use of safe sleep practices. C, administration of medication consistent with the standards of parental consent. D, prevention of and response to emergencies due to food and allergic reactions. E, building physical premises safety. F, prevention of shaken baby syndrome, abusive head trauma, and child maltreatment. And additional topics include G, emergency preparedness and response. H, handling and storage of hazardous materials and the appropriate disposal of biocontaminants. I, precautions in transporting children if applicable. J, pediatric first aid and cardiopulmonary resuscitation, CPR. And K, recognition and reporting of child abuse and neglect. Following the certification timeframes of required training such as pediatric CPR and first aid, child passenger safety technician certification, and food handler certification can also help you to identify when and how often you want to offer a particular training. So the minimum health and safety standards, a guide for American Indian and Alaska Native Child Care Development Fund grantees, is one of the resources that you might want to consult with regarding health and safety standards. And you can, and we'll drop the link in the chat. So we're gonna pause for a minute to see if anybody has any questions. Please feel free to unmute yourself, raise your hand using the icons, or you can enter your questions into the chat. And just as a reminder, you can always reach out to your OCC program specialist or attend the Writing Cafe on Friday, and we'll go ahead and put that link in the chat to register if you haven't already. Any questions? So just as a reminder, if you do think of questions, you can always stop us and we'll get your question answered. Okay, so now let's look more closely at each of the individual health and safety topics. So as we discuss each one, remember that you will first provide a brief summary of how each standard is defined, identifying the specific practices that must be implemented by child care providers based on the age of the children served and the category of care offered. And then you'll indicate how you will require the training topic to be completed by providers by choosing the pre-service option or the orientation within 3 months of hire option. Use pre-service if you will require the training to be completed before the provider begins to care for children. If you choose the pre-service option, the provider will not be allowed to have contact with children prior to the completion of the training. Choose the orientation option if you will require the training to be completed within 90 days of hire. If you choose the orientation option, the provider will be able to work with children prior to obtaining the training, but only under the supervision of another provider who has received training. The training you provide must be comprehensive to include all the various components of the health and safety topic. Providers must be notified that they will be held accountable for to these standards, and provider compliance with the standard must be enforceable through a provider agreement or another mechanism that gives the tribal lead agency state, Indian Health Service, or other entity authority to monitor and provide enforcement. So in a few minutes, we'll engage in an activity together, summarizing a standard with a large group, using 5 questions as a trail map. But first, let's look at a sample standard. In this case, we have chosen the first health and safety topic, and let's see what that is. Okay, so this topic will include addressing immunization requirements and exemptions, exclusions for children who have communicable diseases or disease, and perhaps additional areas of your choice. Consider how these standards may differ across provider type and setting. The age of children within your setting is also important. For instance, standards around diapering don't need to be developed if you're only serving school-age children. So when it comes to topics like sanitizing, disinfecting, hand washing, and safe food handling practices, tribal lead agencies may want to consider reaching out to the U.S. Department of Agriculture, USDA's Child and Adult Care Food Program, CACFP, either locally or via the national website. There are various resources and tools surrounding proper sanitizing, disinfecting, hand washing, and food handling procedures for childcare providers, especially for home providers. So once you have developed your standards around this topic, you will next want to identify the timing of the training around the standard. If you determine that it's important for your caregivers, teachers, and directors to understand infectious disease control and requirements regarding immunization before they provide unsupervised children, you will want to ensure that your pre-service or orientation will cover this topic. It'll be important to identify and reach out to training partners and resources that you want to share with your providers so that they can meet the standards and then incorporate that learning into their interactions with children. Ultimately, you want to see this and all your standards become second nature in homes and classroom settings, not only for your providers, but integrated into the daily routines that children participate in and take home and share with their families, such as routine hand washing or perhaps a cleanup song in your language. Okay, so now that we've reviewed the first health and safety topic, let's work together to identify some strategies to summarizing your standards within this section of your tribal CCDF plan. Through this activity, we may be able to help others who are struggling to complete this section and provide enough information that the answer is approved. You can use the questions on the screen to help generate your thoughts. Then type your answers in the chat box, or you can take yourself off mute and you can share your ideas. Okay, so let's start. So what are some strategies that you have used during last plan cycle? Are you thinking of any additional strategies this plan cycle? So you can go ahead and take yourself off mute, or if you want to share in the chat. So if there's anyone who wrote their last plan, what were some strategies that you had used?
Hi, Carrie, this is Shar.
Hey, Shar.
Some of the information that was shared in Dallas was that they looked at their state's standards and kind of looked at how they summarized their standard and utilized that as a guideline. Also, others basically used the titles of the standard and just a little bit of information to go alongside. There was an issue of space in the last plan, but in talking with others in CARS, there's a lot more room to write those this year. So I'm not sure if people will have the same issue.
Awesome, thank you, Shar. So if you think of anything or you want to share, you can feel free to go ahead and type it in the chat box as we move along. And if people start to respond and you want to save some of those answers, you can save the chat box. There's by clicking the 3 dots and then you click download chat. And just remember, we'll go over each standard and share an example summary throughout the session. And if you want to review the summaries later, you can go to our website and open up the copy of the slide deck. So let's look at another example, one that we have already developed for you. As we review each of the health and safety topics, we will show you a slide with the standard and then follow that slide that contains an example. The example on this slide demonstrates a brief summary of an infectious disease standard. This example uses a combination of published standards and indicates that there are no exceptions to any of the standards based on the age of the child, with the exception of the diapering procedure. All categories of care follow this standard, and training in these standards are provided to all caregivers within 90 days of hire. When providers and centers undergo routine monitoring and there are findings in this area on the inspection, this tribal lead agency has chosen to provide additional ongoing training. This helps to ensure that their providers are aware of the standards set and are given adequate, updated training in the subject when they are not meeting the standards. You'll want to ensure with each standard that the content of the training you provide is comprehensive to all the content of the adopted, or developed standard. The providers are notified that they will be held accountable for the implementation of the learning, and the standard is enforceable by the tribe or monitoring entity. Also, be sure to address any variations based on category of care or the age of the children. So in writing a standard for the prevention of SIDS and the use of safe sleep practices, you can incorporate traditional practices and should rely on safe sleep practices as recommended by the American Academy of Pediatrics. Safe sleep practices might look very different in an in-home setting compared to a tribally operated childcare center, and will vary depending on the age of children served. For instance, crib and mattress compliance and safety on placing a child on their back to sleep may only be applicable to infants. If you serve only older children, you may not need to write the standard at all. Tribal lead agencies need to ensure that providers follow their safe sleep practices for each age group in a center-based child care program. As such, tribal lead agencies need to set standards around infant sleep practices, for example, activities that prevent sudden infant death syndrome, SIDS, and to ensure that providers who care for infants are trained on and met these standards. Likewise, tribal lead agencies would set different safe sleep standards for children of different ages. For example, no safe sleep practices for school-aged children, and would ensure that providers who care for children of other ages were aware of and met those standards. So this example lists all categories of care and all providers, including relative providers who provide care to children under the age of 12 months. Note that they address both sudden infant death syndrome and safe sleep practices, which is important for any standard that has more than one component. This is a potential life-threatening situation and impacts the youngest, most vulnerable children. And so the tribal lead agency has taken the initiative to ensure that training is provided prior to any unsupervised care of children. This tribal lead agency also added additional information, sharing that they provide written material to their caregivers and families on this topic, and even indicating who facilitates their annual training for providers. So understanding how to properly administer approved medications and knowing how and when to contact a parent for both prior and immediate approval of that administration is important. Medication administration includes several different categories and will vary based on age. Infants may routinely be provided with diaper ointment, for example, but insect repellent should never be applied to infants under 2 months of age. So in this example, the tribal lead agency indicates that they have standards related to medication administration that are consistent across all categories of care, and additional standards for center-based care. So they state that the relative providers are exempt from this standard and the training associated with the standard, and they address the ages of children and identify a training partner. So standards in the prevention and response to emergencies due to food and allergic reactions help providers to understand how to identify and prepare for the known allergies of individual children and prevent allergic reactions and respond to emergencies. For caregivers and teachers and directors to feel confident in prevention and demonstrate confidence in emergency situations, you will need to identify specific age-related training requirements, as well as ensuring this topic is thoroughly covered before a provider is left with unsupervised children. So this is an example of a standard that has been adopted from a state standard, like as Shar mentioned earlier, and applied to all ages and all categories of care. It includes all the components of prevention and response outlined by the Office of Child Care, OCC, and timing of the training, as well as the training partner. Safety of the physical environment looks at the building or facility in which the child is cared for, whether that's a home or a center. Safety measures must be addressed in both indoor and outdoor environments, including those indoor and outdoor environments that a child might be exposed to on a non-regular basis, such as a field trip or other outing. Standards may be different for infants, toddlers, and older children. For example, climbing hazards in a classroom environment might not be as pertinent for non-mobile infants or older children, but securing furniture to walls should be a concern for all ages. All equipment, flooring, and windows and doors are universal areas of concern. Depending on your setting, standards should include attention to playground equipment, any water elements such as a river or a wading pool, as well as traffic in the surrounding area. So here is an example of a tribal lead agency adopting a set of standards from the Caring for Our Children National Health and Safety Performance Standards. They applied the standard to all age groups and all categories of care and required pre-service training. If you do have different categories of care or differences within your standard based on category of care, make sure that you address that for each health and safety topic. And now I'm going to pass this on to my colleague, Kate.
Thank you so much, Carrie. So children are kept safe from shaken baby syndrome, abusive head trauma, and child maltreatment when clear standards are written to address proper treatment and maltreatment. Providers need to be aware of developmental stages and what can be expected of a child at certain ages. Training to help caregivers, teachers, and directors understand developmental stages may help to prevent frustration and prevent mistreatment and harm. Keeping children safe includes valuing and demonstrating that we value our caregivers, teachers, and directors in meaningful ways. A comprehensive training strategy that is holistic and addresses the need for children and providers to develop self-regulation skills is important. Access to mindfulness activities, self-regulation, skill building, and referrals to outside medical and mental health treatment for both children and providers could be built into your standards, and quality dollars, as we talked about yesterday, can be used to support these strategies. All right, so in this example, the tribal lead agency has taken, lost my notes for a second, has taken the highest standard that they could find and added policies to the standard to include additional training and standards of care for their child care providers. They cited the specific sections of Caring for Our Children that they have adopted. And note that these standards apply to all ages and all categories of care. For this topic, the standard is that providers must attend training and must subsequently implement the training by adhering to mandated reporting requirements and reporting any suspected abuse or neglect. The Emergency Preparedness and Response Planning Standard requires that child care providers implement written action plans for natural disasters and human-caused events, such as violence at a child care facility. Tribal lead agencies must ensure that all child care providers have a procedure for responding to immediate emergency situations. Be sure to reference section 1.10, which we talked about yesterday, of the Tribal CCDF Plan Preprint, where the child care disaster plan development descriptions are located. One way to approach this requirement may be to share your overall child care disaster plan with your child care providers. Providers will need to be coached to complete their own emergency preparedness and response planning according to your child care disaster plan. So this standard identifies the areas covered within emergency preparedness and response planning, includes monthly drills and documentation of those drills, and lists the required supplies caregivers must have on hand. The topic is identified as a pre-service requirement for all categories of care, and there are no age-specific considerations noted. Tribal lead agencies shall certify that they have requirements for providers regarding the handling and storage of hazardous materials and the appropriate disposal of biocontaminants. All toxic substances should be inaccessible to children and should not be used when children are present. Toxic substances should be used as recommended by the manufacturer and stored in the original labeled containers. The telephone number for the Poison Control Center should be posted and accessible in emergency situations. Toxic chemicals such as concentrated bleach are stored properly and used appropriately, You may also include how and when to use the material's safety data sheets for any chemicals used in a childcare setting. And biocontaminants, which include body fluids or biological matter, sharp waste, and materials used to clean waste, such as used gloves or towels, should be disposed of in a safe way that minimizes exposure and risk to the environment, children, and caregivers. So in this example here, the tribal lead agency that has adapted the recommended minimum standards from the minimum health and safety standards added a section on the disposal of biocontaminants and applied it to all categories of care and all age groups. Precautions in transporting children may not apply to all providers or categories of care. Where transportation is provided to children, this standard ensures that the provider is taking appropriate safety measures to transport children safely. Tribal lead agencies who do transport children as part of their program will need to address the standard providers must meet, including the qualifications for drivers as they transport children, a written permission slip for transportation signed by the parent or guardian, appropriate restraining car seat, booster chair, or seat belt, dependent on the child age or situation, an appropriate temperature of the vehicle, and they must ensure that if a passenger van is used to transport children or guardians, a 15-passenger van is not used. So that's not allowable. This example describes a tribally designed standard that applies only to the tribally operated center. Training takes place prior to unsupervised contact with children during the first 90 days of hire, and there are special considerations noted for younger children who are required by law to be in a car seat. The tribal lead agency has noted that there is a variation in category of care for this standard by stating that they have determined that no transportation of children by in-home or family care providers will be permitted. So we want to stop now and see, does anyone have any questions? You can raise your hand with the icon, you can just unmute, or you can write your question in the chat and we would love to answer. And if you don't have questions at this moment, or if you would prefer to ask your questions privately, you can always reach out to your program specialist at the Office of Child Care, or you can attend the Writing Cafe on Friday. And we also mentioned there will be office hours coming up, so there's lots of opportunities to get your questions answered. Okay, so moving forward, individuals caring for infants and young children must be certified in pediatric CPR and first aid, and at least one staff member with this training must be present for any offsite activity and in each vehicle during transportation. Okay, so I just want to stop because I see a question in the chat. If 15-passenger van is not, when it disappeared. So I think the question is asking, what is appropriate in passenger vans? And I'm gonna turn this over to Shar.
Thanks, Kate. I think that we're going to have to look at the regulations that we received this information from. I believe it would be more of a smaller bus type vehicle rather than a 15-passenger van. So we'll do some research and get back to you on that.
Thank you so much for asking that question, so that we can get that answer and clarification to everybody. And then I see another question from Megan. I am not seeing the plan on my car's dashboard. Do I need to update my user access?
Let's
Sure.
turn that to the CARS team to
Okay.
see if you could just share what she should be looking for.
Okay, great. So Megan, we will get an answer to you shortly. Thank you for that question.
So the CARS team is actually online, or they?
Hi.
Oh, awesome.
Hi, yes, this is Jaquita from the CARS team. So Megan, yes, depending on your access, you may or may not see the 118A plan, full plan. If you have a user account, you need to request updated access. If you are a certifier, you should already see it. I can help you with that. I'll put our information into the chat box.
Thank you. Oh, there she is. She did see it.
Amazing.
Awesome.
Thank you. Perfect.
All right, thank you, everyone. Thanks for asking questions. We really appreciate the engagement. That's what this whole training is for. So I will keep going. So this example here allows for relative providers to obtain the training when it becomes available to them in order to address a lack of training in a rural, geographically isolated setting. And the requirement on the recognition and reporting of child abuse and neglect ensures that the tribal lead agency's child abuse reporting requirements or state requirements as applicable are followed according to the Child Abuse and Prevention and Treatment Act. Tribal lead agencies must have a written policy that addresses the signs and symptoms of child abuse and neglect, as well as creating appropriate reporting processes, which will differ across states, regions, and tribal communities. So, for example, all providers, including in-home and family care providers, caregivers of any type, teachers, and directors are required to abide by this standard. Depending on your tribal code and state law, other staff and volunteers may also be mandated reporters of suspected child abuse and neglect. For instance, in Alaska, any individual who works in a paid or volunteer capacity for any agency that serves children must receive training in and abide by mandatory reporting law. This includes everyone from cooks and administrators in child care programs to bus drivers, janitors, and CEOs. Training for all relevant caregivers and staff should include a broad understanding of the codes, laws, and regulations that apply to your CCDF programs, as well as the depth of understanding in how to recognize child abuse and how and when to report suspected abuse, which is so important. We also want to emphasize that special attention should be paid to the concept of suspected child abuse and assisting individuals in understanding that they are not required to, and in fact must not attempt to investigate or substantiate child abuse themselves. So this example here demonstrates the tribal lead agency's commitment to safeguarding the well-being of the children entrusted to their care by ensuring that all providers understand their mandatory reporting requirements, including a timeline for reporting. The policy assists providers in understanding when to make a report of concern, who to make that report to, and how to make the report. It also references that a provider has a duty to report if they have reasonable cause to suspect abuse. Child development is an additional required training topic and is included under the training and professional development section. Child development includes 4 domains: cognitive, social, emotional, physical, and approaches to learning. Embedded within these categories, you could choose to include subcategories such as language development or problem solving. Tribal lead agencies must establish standards for CCDF childcare services that strengthen the relationship between caregivers and children, as well as provide for the safety and developmental needs of the children served, given the type of childcare setting. Developmental expectations and approaches to learning often vary between cultural groups. Collaborating with local tribal resources can assist in ensuring that proper cultural information is infused into your childcare knowledge and practices when training providers, particularly non-native caregivers, teachers, and directors who are caring for tribal children. Aligning provider training with any parent, guardian, or family information sharing can help to ensure similar messaging is given to children across all settings. This really provides a deeper and more consistent set of expectations and behavioral responses for children and assists caregivers in providing the best cultural and evidence-based practices. So on the screen here is one example of how you might create a training plan, and we'll drop the link in the chat. This slide can be found along with more extensive materials on the subject of health and safety training on the TCBC website. And in a moment, we will be sharing a new resource with you that's going to assist you in creating your tri-annual training plan, including which health and safety topics you wish to cover during pre-service or orientation, and which you want to cover in ongoing training experiences. Remember that the content of any training must be comprehensive to all the content of the standard. Providers must be notified that they will be held accountable for the implementation of the training you provide to them on the standard, and this must be enforceable by the tribe or monitoring entity through inspections and follow-up. The resource can also help you identify the number of training hours for each topic area, the subcategories of training within a topic area, and it will suggest categories of optional standards that you might want to consider. You can find this resource on our website. And let's move into an activity now. So for the next few minutes, we are going to participate in an activity to assist you in beginning to develop a training plan. You are going to be broken into 3 breakout rooms, and we're going to look at one section of the Meeting the Final Rule Health and Safety Training Requirements in Child Care and Development Fund Tribal Lead Agencies. I know that's a mouthful. So we're going to drop the link for the breakout rooms, which is the checklist, and given a link to the resource I just mentioned, with which to begin to develop a training plan to link with your standards. So each group will be assigned one of the 11 required health and safety topic areas to work through based on the breakout rooms you were assigned. So I am going to turn it over to our tech team to start setting up those breakout rooms. Each group is going to be assigned one of the 11 required health and safety topic areas to work through. Groups will have 8 minutes to review the handout and discuss their ideas. And you're going to have a TCB support person that will take notes and then report out to the larger group, which is what we did yesterday in section 1. So let's get going into our breakout rooms, and all of this information that you need is going to be up for you when you're in your breakout room. So don't worry about that.
You can also click the link in the chat if you're interested in pulling it up on your own computer as well.
Oh, thank you, Shar.
At this time, everyone will be moved into breakout rooms. If you are in the breakout room, in the main room, or you find yourself disconnected from the meeting, you can rejoin and then look down at the bottom for the breakout buttons and you can rejoin your room. With that, I will be moving everyone to their rooms.
Thank you.
So I think, is everyone back? Let me see. Let me look at the numbers here. I think everyone is coming back from the breakout rooms. I hope that you had a good discussion, or if you had a quieter group, I hope that you had time to kind of review the checklist document and at least see what is included on there and how it might be helpful to you. So we did want to have a share out. I was the facilitator for topics 1 and 2. So I will just share. We had a quiet group, but one of the participants shared that she is currently doing a feasibility study and in the works of creating a new daycare center, and that this checklist she found extremely helpful as she's thinking about planning and creating this new center. And she also mentioned potentially partnering with Red Cross, different first aid providers, and other entities to offer training. And topics 1 and 2 were the ones that we covered. And I will now ask Carrie. She was the breakout room facilitator for topics 3 and 4 to report out on her breakout room discussion.
Thank you, Kate. So yeah, we had topics 3 and 4, and our group was a little quiet too. So it was administration of medication, and then prevention and response to emergency due to food and allergic reactions. So we just had a question come up about state licensed providers and whether they would have to like write out what the standard is, but Meryl had shared that if they use state licensed providers only, it would skip this section in CARS. So I just reminded the group that if they have questions after, and I shared that sometimes when you're in a training, you're absorbing the information, and then when you're done, all the questions come up, so they can feel free to reach out to their program specialists. And so that was our discussion. Thank you, Kate.
Thank you so much, Carrie. Yes, I agree. This is a lot of information. I feel like people are just absorbing it right now. So no worries if that's where you're at. And, you know, we are the regional office are always here to assist with questions. I'm going to turn it over to Shar for topics 5 and 6.
Thank you. Our group was absorbing things as well, but some of the things that they felt were this would be really helpful in planning their health and safety training requirements and developing a timeline. But one of the other highlights is they thought it could possibly or potentially be used as a part of their monitoring system, and kind of, you know, utilizing it to see which of the trainings of providers, staff, or directors have, and kind of using that as a piece of their checklist. So those are the high points of our conversation.
Thank you so much, Shar. And now over to Teresa for topic 7 and 8.
Okay, thank you for that. We had topic 7, which was emergency preparedness. I had Jenny in the group, and she was very responsive, and I'm sure helped out the group too when she shared her information, what they do at her center. So they're set up for, you know, for emergencies such as floods, wildfires, snow when it's too hot. We talked about the temperature, how she gets that information, about the temperature being too high or too low for children to go out onto the playground, and they monitor that. Also, we talked about the wildfires, the air quality information, which the tribal department monitors that and will email that out to everyone to let them know when the air quality is not at a level that the children should be going outside. Jenny also talked with me about the communicating to families about emergencies, which is really important to make sure that the families know what's going on. And she said that they use Facebook Messenger and they are set up by certain classrooms. So if there's classrooms that don't need to be involved in whatever the situation is, you don't have parents from those classrooms receiving the information. Also, the tribe uses the phone messaging, and I forget what it's called right now, where they send out a recording to all the people in the need to know, depending on what the emergency is as well. And that led into that the running drills, and Jenny talked about that they partner with the tribal police department very closely. And when I guess there was a situation, it wasn't really known if it was an active shooter or, but it was sounded like it was a hard lockdown situation. The police were on site. They were outside monitoring the situation there, making sure that parents weren't coming into an area that they shouldn't be in as they were receiving this information. We all know how we are about our children. First thing we want to do is get our hands on them under situations of emergencies. And Jenny also shared that the police department leads their drills, for instance, for active shooters. So that was a lot of great information. And thank you for letting us share that, Kate.
Thank you, Teresa. Really appreciate that. So let's move on to our next person. So Safi had topics 9 and 10. And due to time, we'll have to make the last couple of these short just because we have more to cover, but Safi, take it away.
Understandable. So topics 9 and 10 were transportation and pediatric first aid and CPR. The transportation one was fairly short because that's not applicable to all, centers and providers. I did share out an example of like how my daughters go from being picked up from their elementary school to the tribally operated center that they attend for after school care, picking them up. And so one thing that we had at the beginning, was, looking over the state laws for car seats and things like that. And it's also a good opportunity to partner with I didn't say this in the meeting, but to partner with to the local fire station as well. For pediatric first aid and CPR, they did share out. We had one person that talked about how their tribal lead agency pays for training for childcare providers and anyone that's caring for CCDF children. And then keeps track of that. And that's a great way to make sure that there's consistency across training, a great way to keep up with tracking and monitoring it. And then also a great way to encourage more people to become providers to develop that workforce. I'll pass it back to Kate.
Thank you, Safi. Okay, so we would love to hear from everyone, but unfortunately we have more slides to cover. So we are going to move forward with the presentation, but thank you everyone for participating in this activity, and maybe share in the chat, Sarah, Nazba, and Dee, if you wouldn't mind sharing some highlights from your discussion. We would love to hear those, and let's continue with the training. Okay, so we're going to move into some specifics about ongoing training requirements. Tribal lead agencies must specify the minimum number of annual training and professional development hours required. The ongoing training requirement does not necessarily have to include all health and safety standards on an annual basis. Tribal lead agencies have the flexibility to determine which health and safety trainings, including prevention and control of infectious disease, should be repeated and how often they need to occur as part of the ongoing professional development for caregivers, teachers, and directors. Again, you may consult with Caring for Our Children basics and/or minimum health and safety standards for best practices and the recommended time needed to address these training requirements. Another helpful approach might be to follow the certification timeframes of required training, such as pediatric CPR and first aid, child passenger safety technician certification, and even food handler certification. In your plan preprint, you will need to specify the number of hours of ongoing training you are requiring for the type of child care you will provide. And for example, prevention of sudden infant death syndrome and safe sleeping training is only necessary if a caregiver cares for infants. Similarly, if an individual is caring for children of different ages, training in pediatric first aid and CPR should include elements that consider that practices differ from infants and older children. So for providers that care for school-age children, lead agencies may need to develop requirements that are appropriate for that stage of development. Another consideration is variation of standards, or in variation of standards could be in language nests, cultural camps, and seasonal fish camps, or other after-school or summer activities. For instance, many tribal lead agencies have expressed difficulty in training seasonal staff in health and safety standards in a comprehensive manner. So one way to address this might be to consider training your permanent staff during the fall or winter on all health and safety topics. This way you have designated trained staff in each of the required health and safety standards, and these individuals can staff the different camp locations and supervise the seasonal staff who may have only received the basic health and safety training. So that's one way kind of around that issue. Next slide. Your description in section 2.2.3 should include methods to ensure that providers can maintain and update the health and safety practices that you described in your standards. Include any variations based on the category of care or ages of the children served. Examples of this could be the differences in how you convey information to providers within different categories of care. For instance, perhaps you inform family care providers about updated policies by letter, and you inform center directors about updated policies by email. And as you saw in the handout, we just work with CCDF flexibility allows for optional standards to be included as well. These optional standards can include those related to nutrition, access to physical activity, care for children with special needs, and any other topic determined to be relevant by the tribal lead agency. In the handout you saw, suggestions to identify trauma-informed care and workforce development wellness as optional standard areas or subtopics to cover within another standard. So that was an example that was on the checklist. Does your tribal lead agency include optional standards in this area beyond the required health and safety topics? So if your answer is yes, you will need to answer the questions 2.2.3.2 through 2.2.3.5. If not, the CAR system will skip you to 2.2.4. Traditional Native American foods, for example, fresh grown fruits and vegetables, hunted game, and fresh fish may be served as described in the United States Department of Agriculture Memorandum Tribal Participation in the Child and Adult Care Food Program and the Summer Food Service Program. So these talking points, I know this is a lot, these talking points are all included on our website with the slides, just FYI. And are we on? Okay, sorry about that. So children should have opportunities to engage in moderate to vigorous activities indoors and outdoors. Toddlers 12 months to 3 years should be allowed 60 to 90 minutes of physical activity per 8-hour day, and preschoolers 3 to 6 years, 90 to 120 minutes of physical activity per 8-hour day. Tribal lead agencies should limit screen time, and this includes television, DVDs, video games, phones, computers. There's so many different screens nowadays, to meet state requirements or adopt their own requirements regarding screen time. Tribal lead agencies should consult with other tribal nations when developing their own screen time policies. All requirements should meet the American Academy of Pediatrics Council on Communications and media recommendations for screen time and digital media use. Any child who meets special needs criteria in an early care and education setting should have an up-to-date routine and emergent care plan completed annually by their primary healthcare provider, with input from parents or guardians included in their on-site health record and readily accessible to those caring for the child. Tribal lead agencies may establish, implement, and enforce requirements related to any other subject area determined by the tribal lead agency to be necessary to promote child development or to protect children's health and safety. Examples include quality sleep, age-appropriate screen time, partnerships with child care health consultants, and standards relating to Indigenous knowledge specific to children's health and well-being. The other subject areas defined by the grantee can also be reflective of the specific needs of your community, of your children and families that you serve. And now we're going to break for questions. So please let us know if you have any questions. Feel free to unmute or put it in the chat. If there are no questions, I'm going to pass it off to Shar to finish us up for the day.
Thanks, Kate. Remember, if we are kind of moving fast, if you have any questions, feel free to reach out to your regional program specialist for additional help, or attend those writing cafe on Friday or the office hours. We want to make sure that after you kind of absorb this information, there's still additional opportunities for questions. So tribal lead agencies are required to establish childcare standards for all provider types receiving CCDF program funds regarding appropriate child to staff ratios. So by age range of the child, group size limits for specific age populations, and the required qualifications for providers based on the type of care setting. So for example, center-based child care providers, which includes the tribally operated centers, family child care providers, or in-home care providers. This requirement also applies to providers who are only receiving quality dollars. So providers receiving quality funding only, as opposed to receiving subsidy payments from the tribal lead agency, may include, for example, tribal language and culture camps, language nests, school break camps, etc. Remember that tribal lead agencies have the flexibility in defining standards and provider types that are reflective of the culture and language and that meet the needs of the children and families served. The final rule does not establish a federal requirement for group size and child to staff ratios, but does include some recommendations. In this question, you'll want to describe your standards for child to staff ratios and your group sizes for CCDF providers. Think about the way that you define different age groups for each provider type that you serve. Also think about whether you have mixed age groups that you need to define. You will need to establish teacher caregiver qualifications for each category of CCDF providers. Think about each provider type you have. Remember that center-based providers include any tribally operated centers. Let's think about qualifications for your teachers and directors and what are the concerns that you have in the area of qualifications. So we have a couple of resources that we developed specifically to help you answer this question. The first one is determining child to staff ratios and group sizes to ensure the health and safety of children in care. It's a tips and considerations document for all allocation sizes. And this resource provides information that could be helpful in making decisions that will best fit your community's needs. Again, it's set up very closely to the same format of the document that Kate shared yesterday in the quality section. It kind of walks you through the process as you start determining those staff to child ratios. You can find a copy of this resource on our website, the website that Safia walked through this morning. This document is there, and we're going to put the link into the chat box for this document as well. So that'll take you right to that particular document. And then the second resource is determining provider qualifications to ensure the health and safety of children in care. It's another tips and considerations document that are for all allocation sizes. It'll kind of walk you through the thought process of determining those qualifications. Remember, you can have different qualification requirements for different types of provider that you're using. And also CARS will only pull up the provider types that you've selected in section 1.7.1. This one we'll also put into the chat box. And so we'll move on to our final resource on this particular section of the plan. For each section, we've developed a resource directory, and it's divided by each subsection of the plan, different resources that might be helpful for you as you start working through this section. It does include additional resources than the tips and considerations documents. So if you still are struggling in one particular section and you want to look up some additional information, this is a helpful resource. And this resource directory is for all of section 2. That includes monitoring and criminal background checks and relative providers that we'll be talking about in our next session. So we'll also put that in the chat. All right, so we're going to stop here briefly to see if anyone has any questions. All right, so we're going to move on. We want to thank you for joining us as we address the first 2 topics of section 2 in the fiscal year 2023-2025 tribal plan. We'll be moving on to section 2B after the break, where we'll be covering monitoring exemptions for relative providers and comprehensive background checks. So again, we will offer a moment that you reflect on any questions you may have from this section of the plan during the break. If you think of something, write them down. We can definitely assist you in the next session, or maybe you want to bring some of those questions to the office hours or the writing cafe. We do realize some of your questions may involve your tribal leadership and internal planning team. So we do have those office hours that will be continuing through January. Okay, so we want to thank you for your time. We appreciate your feedback. We're going to pop the link for the feedback survey in the chat. Again, this is for the entire virtual training. You don't need to complete it after each session, but when you have availability, that would be great. And then remembering on Friday, we have that regional meet and greet and writing cafe, and we'll pop the registration link for that in the chat as well. It is not the same link that you've joined us during the rest of the virtual presentation. So, and we'll also pop the link for the office hour registration as well. So thank you all. Enjoy your quick half an hour break. We actually ended with almost a minute to spare today. And so we'll see you at the top of the hour. Thanks all.